Welcome to the Valseth View.
Hello and welcome to the Valseth View. Today we're going to take a look at compliance and what that means for what your company does. So I'm Carolyn Dragseth. This is Valerie Clark. And Valerie is going to give us an overview of what compliance is. And this is how Clark Synergy is looking at compliance for our clients. So Valerie, I'm going to hand it over to you. And this is an overview of what Clark Synergy does in the compliance field for our clients. So Valerie, take it away.
Thank you, Carolyn. We did want to talk a little bit this morning about both of our individual companies, which I believe our strength is that we come together as one company and we each bring our background into it. We have a lot of the same experiences from a company standpoint, but it's the focus that makes the big difference. My background has been in healthcare compliance, both in the hospital setting and also in the long-term care setting. And then most recently, I worked for a state agency here in Louisiana for about 16 years doing compliance. So I have healthcare compliance. I have long-term care compliance, which for those of y'all that know, hospitals are different than long-term care facilities. And then I also have a government agency who has to comply with both the state regulations and the federal regulations. And if they disagree, which one trumps? So it's a lot of education. It's a lot of keeping up with what's going on. So basically, I have worked in the fields of civil rights. That includes civil rights investigations, whether that's for the American with Disability Act's investigations, workplace investigations, helping with workplace accommodations, helping employers understand what that is, what that means, what words don't have to be used. It also means that in those investigations, if I came up with something, a finding or something that we were not compliant with, then I worked with the executive administration to get us in compliance. And sometimes it was a really easy fix, and sometimes it took a little bit longer. But the important thing, especially with the civil rights, is to make that person whole and to do the best that we can do for that person, which means compliance, as quickly as we can. I do want to put a little caveat in here that most people don't realize is when you get a civil rights complaint or you have a civil rights issue, you don't have a non-ending amount of time to get that right or to correct it. As soon as anyone in your company is notified about the need for an accommodation or that they feel like that they have been discriminated against based upon a certain area, then your company has been put on notice. And that's when the clock starts for the federal agency, whether it's the Department of Justice, the Equal Employment Opportunity Commission, whether it's the Department of Health and Human Services. That's when they say that you as a business owner are aware of the issue and when you should have started taking action. It's not waiting for these people to sit down to discuss it and then setting up a committee meeting and pushing it down the road. That's not how it works. So I really want to caution you to not take too much time in finding a resolution. Likewise on that, there are several different agencies or companies, nonprofits that I worked with over the course of time that are so helpful with accommodations, such as the Job Accommodation Network at jan.network, JAN.net, I believe. And they have information available on their website. You can email them, you can speak with someone, and they have such a large variety of tools for you to use as an employer and as an employee. And one last thing about them is you can contact them and reach out if you have a generic question. Say you're changing computers and you want to make sure that those employees that are currently using some type of a vision application or vision software to help them see something better, that they can tell you what is going to be compliant with the new system. And then they can also help you based upon a particular medical diagnosis. If someone has been diagnosed with maybe diabetes and they need some accommodations, then they can help you work through what are some reasonable accommodations that the agency or the business can grant. Other things that I would do would be, whenever I would find a compliance issue, is I would work with the executive management and the supervisors, because training has to go into that. Because I guarantee you that if you have one person and you are able to substantiate a validation of discrimination or a civil rights issue, there's going to be more behind it. So just don't think that it's one person who had this issue, especially if you're a larger company. There are more people who just may not say anything. So by doing the education, by doing the training with the executive management and the supervisory staff, along with the frontline staff in your different offices, is very important. Number one, to make sure that they know what's available. And number two, if they have a question or a problem in the future, that it is very okay to ask the supervisor and to run it through human resources, whatever your policy may be, because you as an employer want to accommodate that employee, or you want to make sure that whatever the issue that has arisen has been resolved, and that it remains resolved and it doesn't pop up again. Along with all of that I've just said, my background is in social work educationally, and I've worked in that for a while, but in every job I've ever had, I've always done compliance, employee relations, guest relations, customer relations. And the whole point of all of my background, summed up very simplistically, is I help you put into place effective systems that will remain in place. You have to review them, but they will remain in place and they will help keep you compliant with whatever the issue may be, whether it's healthcare, whether it's like hospital setting or long-term care, whether it's a government agency, whether it's your business who handles marketing, whether it is a business that you all work internally in some type of an industrial setting. There are systems that you can put into place, and that is part of what I bring to the table. Is I know how to develop systems, I know how to review them, I know how to make them work. Do you have any questions you want to ask?
Well, I think I have a little bit of a question, because you talked a little bit about two different things that are in the compliance realm. And the first one was, you talked a little bit about what it means when you have a civil rights issue within a company versus what it means if you have an actual compliance issue. So can you kind of explain that for our guests so that they can kind of get an overview of that?
Thank you for asking me to clarify that, because I do not want to walk away from this with you thinking that a civil rights issue equals a compliance issue, nor that a compliance issue equals a civil rights issue. They can, but they don't always.
Right.
I've discussed, what a civil rights issue would be. A compliance issue would be based upon a different type of a regulation, such as if in healthcare or if in your industry you have new standards that come out that require particular policies or that require particular processes to get from point A to point B. And they're very, very particular about how you do that. Many times, especially larger companies will acknowledge it maybe in a board meeting, but fail to put into place the compliance steps that are necessary to get you as a company into compliance and then to stay in compliance. And so it doesn't have to be a negative issue that arises. It could be based upon new regulation. It can be based upon if you have a corporate office who comes in and says, okay, we've decided at the corporate office level that we want to put in X. And we're not particular about what you do to get to X. You just have to get to X. And we'll be back in 30 days and we're going to review the system and the process that you have in place and make sure that you're compliant with X in 30 days. So that kind of leaves you with, oh my gosh, do I know what this is? Do I need to research it? How do I find out how to fix it? And who can I call to help? Well, the good news is you could call Valseth Enterprises to help, and we'll be more than happy to help in something like that. So many times you're exactly right. A compliance issue does not stem from a complaint or from a deficiency or from a citation. It can come simply from an industry standard. Maybe it's a standard of community practice. I mentioned a couple of different agencies that I have worked with from a federal standpoint. I've worked with the U.S. Department of Agriculture, the Department of Health and Human Services, the Department of Justice, the Equal Employment Opportunity. And I can tell you that they know their stuff. And if they were to contact you and there is an issue, you need to pay very close attention. Most of them are very good about making sure that you have a good understanding of what may be deficient so that you can correct it. But what I like in my experience with federal agencies is if you have a question, they're open to you asking it. How they answer it's going to differ, of course, but my experience with them is, they're not the bad guys. They're not the people who are going to come in and shut you down unless you do something really, really badly. And they usually don't do that on the first run through your building. But when you, going back to that scenario of if a corporate office comes in and says you have 30 days in which to change something and get the system into place, if you really don't know who to contact or where to go to whatever federal agency is monitoring that particular compliant feature. And they may especially if it's new, they may give you some guidance on what to do, what to look for, some things to watch out for, and pick up the phone and call someone. I know that I'm at the age where that's much more comfortable for me than, necessarily typing an email message, but there are multiple people out there who are able to help you.
So I have a follow-up question. Let's say, for example, I'm a company and I'm not really familiar with compliance and I don't know what to do. It's my first government contract, or it's the first time that I've had to work with a particular federal agency. Can you kind of tell me what kinds of things Clark Synergy and or Valseth Enterprises can help out with? And I'm talking in the realm of compliance because I know that that is your world. And I think it's very important for people to understand, like, if I come to Clark Synergy and I say, hey, I've got a new contract, what are some of the things that you're going to work through with me, or how can you help me?
Okay. So if you come and you say, I have a new contract with this federal agency, and I'm not really sure what the compliance responsibilities are, one of my first questions is going to be to ask you, because I'm going to assume at that point that you're the person in charge of the company. And if not, then I'm going to get the person who is in charge on the phone with us, because this conversation should have taken place before the contract was ever signed. just to be honest, because what if you can't meet it? That's a different issue. But the point of that is you need to start the compliance conversation whenever you have a desire to reach out and to submit something and try to win a contract, or you are a recipient of federal funding. And just because of that contract that may have been in place for 30 years, but it's still a valid contract, there are regulations there that they bring to you and say that you have to do that. I'm going to assess your understanding of what is being asked of you. I'm going to assess where do you go for knowledge? Who are the people that you perceive as experts, whether it's inside the company, outside the company? And then I'm going to ask, what research have you done? And then I'm going to ask specifically after we discuss that, and that may be a 30-minute conversation, depending upon what you've done. Then we're going to get into the weeds of, okay, so tell me what you got. Tell me what you have. Tell me what your concern is. And then we're going to discuss that. And then hopefully at the end of that conversation, I will be able to give you 3 or 4 different ways that I will be able to specifically help you, whether it's by, we need to develop these particular systems. We need to go back, in addition to developing those systems, we're going to have to write policies. We're going to have to do training. And then there's a conversation of, do you do one-on-one training? Do you do training through a training system that employees can access anytime during work hours? Then there is where's your compliance department? Where's your legal department in this? How are they going to function and follow up to make sure that it stays compliant? And then if there is a part of it that touches a client, then we're going to need to talk about that system because, that basically turns it into two systems. You have an internal system or an internal process of making sure that you reach this compliancy requirement. But if you have employees or vendors or someone from the outside that work with you to develop that, that work with you on that, or if they have a problem with that particular issue, then we need to talk about how are we going to make sure that the clients or vendors know who to contact, when they can contact them, what to expect. And those are all really important things. And then after the conversation, then I'll of course follow up in writing and be more detailed about specifically what I can offer.
Okay, and I just don't want us to leave this topic talking about Clark Synergy and compliance without kind of touching on your expertise with healthcare, because I know that being in that healthcare realm is a little bit different.
Yes.
There are more kind of arms reaching into it. So if you could give us an overview kind of what is your experience with healthcare clients or companies that work specifically in healthcare?
My experience is in hospitals for about 9 years, where I ran a social work department with 36 social workers. So it was a teaching hospital. And we were a publicly funded hospital. And so because of that, there's a lot of community involvement, a lot of political
schmoozing.
Yeah. Necessary, but important. But in that particular setting, I also worked in administration. In that particular setting, I worked a lot with the physicians who were in training, because in the social work realm, because once you're a social worker, you never stop being a social worker. You use those skills and everything that you do. A lot of my conversation and trainings with them, and I would even go with them to talk with families about maybe someone who had taken a turn for the worse, someone maybe who had surgery and didn't make it through. One of the things that I did at 2 different hospitals that was very fulfilling for me was my master's thesis was on grief and death and dying. And in both of the hospitals I worked in, I was able to actually co-facilitate a cancer support group for families of loved ones who had cancer or were going through cancer, and also for cancer patients themselves. I don't want to get off track from your question, but
well, I think everything that you've mentioned up to this point kind of ties into the idea of compliance. And I like that you've brought in the fact that you have some research expertise, because I think our clients need to know that when we're advising clients, even ones that are in the research realm, you've had experience actually building that from the ground up. So that's an important tip for everybody. But I didn't mean to interrupt. But yeah, going back to healthcare compliance, what if you had to pick one thing where you've seen healthcare compliance really be stringent? What would you have anyone who works in that field kind of focus in on? Other than the Joint Commission, because we all know that those are going to, I could see your wheels turning and they were going right there. But if you had to give them a tip of, I'm starting out in providing healthcare services to someone or doing something like that, or like, for example, here in Louisiana, there's a lot of interest in the new kind of caregiver support teams and things like that. What's one thing that if I was going to foray into that new realm, what is one thing you would say, hey, you might want to have this in place before you get too far down the road?
You're not going to be surprised at my answer. I was in healthcare total for about 18 years, and it's the one thing that I learned every day. And it's the one thing that you do every day in healthcare, and that is you do teaching, you do training, because we all know people in healthcare work with lives. And you think people are comfortable with that because they chose that profession. Some are, some are not. Especially as a leader, you need to make sure that you are providing the right training, the right equipment, the right information, the right people to each department of your facility, because training someone who is in the business office about patient rights is very different than training someone in the emergency room who is working on patients on patient rights. It's very different. And there is no topic that is going to escape needing to be trained on.
Okay.
So,
All right. Well, I just want to kind of add in at the end that I think that one of the reasons that we formed Valseth Enterprises was because we realized that there's a lot of kind of overlap and synergy between what happens in the compliance realm and then
right.
what happens with your legal end as well. So thank you so much for sharing with us what Clark Synergy does, the compliance aspect of it, and some helpful tips as far as what people need to do when they're looking for compliance assistance. Like we've said before, if you want to get more information, you can always reach out at www.valsethenterprises.com. So thank you for tuning in today, and thank you for listening and learning a little bit more about compliance.
Thank you.
Thanks for watching. Be sure to hit that like and subscribe button and leave us a review in the comments.